Hello everyone. So today's topic of discussion is uterus, and this will be discussed under following headings: positions and parts of uterus, gross anatomy, peritoneal reflections covering the uterus, relations, supports, blood supply, and lastly the applied anatomy of uterus. Starting with some introductory points, we already know that uterus is a child bearing organ in the females, and this is also the site for implantation of a fertilized ovum as well as development of embryo. So basically it is that organ in which female bears her child. It is a hollow organ, which means it will have a lumen, and this lumen is very narrow. It has thickness of just 2.5 centimeters, and the reason it is going to be having a just 2.5 centimeters of thickness is because it is flattened antero-posteriorly. Antero-posteriorly the uterus is completely flattened, which gives it a thickness of just 2.5 centimeters. It is thick walled. As we can see, this has a very thick wall, and this thick wall is made up of muscles, and that muscle is called as myometrium. So this muscular thick wall, which is the myometrium, makes it to have a very narrow lumen, and it is situated in the lower pelvis in between the bladder and rectum. So if we assume that this is a bladder and this is a rectum, in between these two we have the uterus, and that way it is located in lower pelvis in case of a female. If a woman has an empty bladder and if she is standing in an erect posture, the long axis of uterus is supposed to be horizontal. So if she has an empty bladder and if she is standing in erect posture, the location of the uterus will be horizontally, and it will not be vertically located. It will be located horizontally, and therefore the long axis of uterus will be horizontal in case of an empty bladder. It is a pear shaped organ. As we can see, the shape of the uterus is pears, and it is flattened antero-posteriorly, and therefore it has a very narrow lumen. Dimensions of uterus: it has a length of 7.5 centimeters, subtract 2.5, breadth will become 5 centimeters, and subtract 2.5 further, this will give a thickness of just 2.5 centimeters, and therefore it has a narrow lumen. Parts of uterus: uterus can be broadly divided into two parts. The first one is body of uterus and second one is cervix. The first is the body of uterus, which is composing the 2/3 of the uterus, and the lower 1/3 is the cervix of the uterus. Now the upper part, which is also called as the body of uterus, it is larger as well as it is pear shaped, and it is going to compose 2/3 of the whole uterus. Whereas the lower part, which is cylindrical in shape, is called as cervix. It is going to compose just 1/3 of the whole uterus. Now isthmus is basically a circular constriction which is located in between the body of the uterus as well as cervix of uterus. In between these two, the circular constriction is called as isthmus, and this isthmus is more prominently seen when it is viewed from the anterior direction. Cornu of the uterus: so basically cornua is the junction between the fallopian tube and body of the uterus. So whatever junction is there between body of uterus and fallopian tube, that is called as cornu of uterus. Now let us understand the openings of a cervical canal. So there are two openings. One is internal os, which is located internally, external os located externally. Internal os is basically the opening which connects the uterine cavity to the cervical canal. This is a uterine cavity and this is a cervical canal. In between these two we have a circular opening, that is called as internal os, connecting the cervical canal and uterine cavity. Second one is external os, which basically connects the cervical canal to the vaginal cavity, because just below the cervix we have the vagina which is located. So between the vaginal cavity and the cervical canal we have the external os. Now the external os, when it is taken in the form of transverse section, it usually has two types of appearance, which will differ in a nulliparous woman and a multiparous woman. So in case of nulliparous woman, basically a woman who has never been pregnant, who has never bared a child, in her case the external os will appear to be circular. But in case of the multiparous woman, the external os will be appearing in the form of a horizontal slit. So based upon the appearance of external os, we can identify if she is a nulliparous or a multiparous woman. We'll study about the first part of the uterus, and that is the body of the uterus. The first part of the body of the uterus is the fundus. So fundus is basically the upper dome-like end of the body of the uterus. This is called as fundus. Now fundus can be formed when we actually draw an imaginary horizontal line which is passing through the two openings of fallopian tube. When we draw a horizontal imaginary line, so whatever upper dome shaped part of the body of the uterus is formed, this is called as the fundus, and this fundus is covered by peritoneum on all of its sides. The second one is body itself. Now this body is going to extend from the fundus to the isthmus. So if this is the isthmus, which is the junction between the body of the uterus and the cervix, so in between the isthmus and the fundus, whatever part of the uterus will be there, that will be called as the body of the uterus, and it is antero-posteriorly this body of the uterus will be flattened, which means its thickness is just of 2.5 centimeters, as already discussed earlier. Surfaces of body of uterus. So when we have a look at the body of the uterus, it can have two surfaces. One is anterior surface and another one is posterior surface. Now anterior surface is supposed to be completely flat and the posterior surface is convex in shape. So this is a convex shape, the posterior surface, and anterior surface of the uterus which is completely flat, and the convex surface which is seen posteriorly. Now the anterior surface of the uterus, whatever is there, it is covered by peritoneum till the isthmus, and the posterior surface is also covered by the peritoneum but only till the posterior fornix of vagina. So we'll understand it with the help of diagram. So if this is the anterior surface and if this is a posterior surface, anterior surface is flat, posterior surface is convex. Anterior surface is covered till the peritoneum only till the isthmus. Isthmus is a junction between the cervix and the body of the uterus. Between the cervix and body of uterus, the junction is called as isthmus, and till here only the peritoneum is going to extend. Further, the peritoneum reflects onto the upper surface of the bladder, and because this peritoneal pouch is present between the uterus and the bladder, so therefore it is called as uterovesical pouch. The second one is peritoneum, which is covering the posterior surface of the bladder. Now this peritoneal fold will extend till the posterior fornix of vagina. This is a posterior fornix of vagina. Till here the peritoneal fold is going to extend, and further this reflects backwards onto the anterior part of the rectum. And because it is present between the rectum and the uterus, it is called as a recto-uterine pouch or the pouch of Douglas. So anterior surface is covered by peritoneum till the isthmus, and the peritoneum is reflected on the upper surface of the bladder, and this pouch, whatever has been formed, is called as a uterovesical pouch. The second one is the pouch of Douglas. In the posterior surface of the uterus, as we can see, peritoneum is covered till the posterior fornix of vagina, and then it will be reflecting towards the anterior aspect of rectum, and this will be forming one of the pouch, and that is called as recto-uterine pouch, which is also called as the pouch of Douglas. Right and left lateral border of uterus. So these right and left borders of the uterus, they are actually attached to the broad ligament of uterus, which we'll discuss further, and this right and left lateral borders are not at all covered by peritoneum. So therefore these borders are non-peritoneal and they are mainly related to the uterine artery. So this is the right and left lateral border. Here we'll be having the uterine artery as well as the broad ligament which will be attached, and the fallopian tube enters at the upper end of this border. The fallopian tube is going to enter the uterus at the upper end of this right and left lateral border. Cervix is the second part of the uterus. As already discussed, the upper 2/3 is the body of the uterus and the lower 1/3 is the cervix of the uterus. This cervix projects into the upper part of vagina through its anterior wall. So cervix further opens into the vagina with the help of its anterior wall. It opens into something called as vagina, which is the next part after the cervix. Cervix has two parts, one is the upper part and second one is the lower part. The upper part of cervix is called as supravaginal part, and second part, the lower one, which is called as the vaginal part. So this part of the cervix which is located above the vagina is called as the supravaginal part, and this part of cervix which is located within the vagina is called as the vaginal part of the cervix. So upper part which is located above the vagina is the supravaginal part, and the lower part which is located within the vagina is called as the vaginal part of the cervix. Supravaginal part and vaginal part of cervix. Clinically, there is something called as isthmus. We already studied. It is a circular constriction between the body of uterus and the cervix. Now this isthmus is going to be formed by the upper 1/3 of supravaginal cervix. Supravaginal cervix, the upper 1/3 of the supravaginal cervix is going to form this isthmus, and this isthmus is going to be structurally similar to the uterus, and because it is structurally similar to the uterus and because it is located in the lower part of the uterus, this isthmus is also called as lower uterine segment by some of the obstetricians. It is referred as lower uterine segment by the obstetricians. Next topic to be studied under uterus is the different positions of uterus and axis of uterus. Normally the uterus is having two different positions. First one is the position of anteversion and second one is position of anteflexion. Now this position of anteversion is due to an angle which is called as angle of anteversion, and position of anteflexion is due to an angle which is called as angle of anteflexion. In both of the cases we always take the long axis of vagina considering. So in both cases the long axis of vagina will be considered. the angle of anteversion will be between the cervix and the vagina. So because there's a ver and cervix, so anteversion will be between the cervix and the vagina, whereas anteflexion will be between the body of the uterus and vagina. And as we said, the long axis of the vagina is common in both of the things, in both of the angles, angle of anteversion, anteflexion. The long axis of vagina is common. Anteversion is between the long axis of the cervix and long axis of vagina, whereas anteflexion is between the long axis of body of uterus and the long axis of vagina. So anteflexion is between the body, flex your body, so body of the uterus and vagina will give you the anteflexion angle, and between the cervix and vagina we have cervix and then anteversion. So as we can see, this is the first one, that is angle of anteversion, and this is the angle of anteflexion. So anteversion is between the long axis of the cervix and between the long axis of vagina. So between the long axis of vagina and between the long axis of cervix we have an angle, and that angle is of 90 degrees, and this angle is itself called as the angle of anteversion. And the one which is located between the long axis of flex your body, which means long axis of the body of uterus and the long axis of the vagina, this angle which is formed between the long axis of the uterus and the long axis of vagina is called as the angle of anteflexion, and this angle is 150 to 170 degrees. Now importance of these angles is that these angles will help to keep the uterus in its position. These angles will prevent the uterus to get prolapsed. So as already discussed, anteversion is the formed by long axis of cervix which is normally bent forward on the long axis of vagina, and therefore this position of anteversion will form a 90 degrees angle. And the angle of anteflexion is formed between the long axis of body of uterus which is bent forward at the level of isthmus on the long axis of cervix, and it forms an angle of 170 degrees, and this is called as the angle of anteflexion, which gives a position of anteflexion. And the importance of these angles and position is that it prevents the uterine prolapse. Further discussing about the relations of uterus, so we are going to discuss the anterior relations of uterus, the posterior relations of uterus, as well as the lateral relations of uterus. First, starting from the anterior relations of uterus, so we can understand it with the help of diagram. So if this is a uterus, anterior to uterus we have the urinary bladder, and posterior to the uterus we have the rectum as well as the anal canal. So anteriorly we have mainly the four relations. The first relation which is present anterior to the uterus is the uterovesical pouch. So this is the uterovesical pouch present between the uterus and bladder. This is the uterovesical pouch. The second one is the superior surface of bladder, not a complete bladder, just the superior surface of the bladder is situated anteriorly to the anterior surface of uterus. Next one is the base of the bladder, and the last one is going to be the anterior fornix of vagina. So the one which is related to the body of uterus is the uterovesical pouch and the superior surface of the bladder. This part is called as the supravaginal part of the cervix, as already discussed, because this is present above the vagina, so therefore this is the supravaginal part of cervix, which is related to the base of bladder. So this posterior surface of bladder is also referred to as the base of bladder, and therefore the supravaginal part of cervix is situated just behind the base of bladder. The third part is the infravaginal part of cervix, or we can also call it as a vaginal part of cervix. This vaginal part of cervix is anteriorly covered by the anterior fornix of vagina. Basically vagina has four fornices. The first one is anterior, second one is posterior fornix of vagina, and there are two lateral fornices of vagina. So anterior to the vaginal part of the cervix we have the anterior fornix of vagina. Similarly posterior we have the posterior fornix of vagina. Further, the posterior relations of the uterus. So posteriorly, as we had the uterovesical pouch in the anterior, we will be having the pouch between the uterus and the rectum, which is the recto-uterine pouch or the pouch of Douglas. And this pouch of Douglas has the coils of small intestine. So this is the relation of body of uterus. The cervix will be related to the posterior fornix of vagina as well as the recto-uterine pouch again. So if this is the cervix, it will be related to the recto-uterine pouch as well as it will be related to the posterior fornix of vagina. So the anterior part will be related to anterior fornix of vagina and posterior part will be related to posterior fornix of vagina. So this discusses the point which is discussed in the diagram itself. So first we have is the body of uterus. The body of uterus is anteriorly related to the uterovesical pouch as well as the superior surface of bladder. Supravaginal part of cervix, as we already know, the supravaginal part of cervix is related to the base of the bladder or the posterior surface of the bladder, whereas the vaginal part of cervix is related to the anterior fornix of vagina, and the same vaginal part of cervix posteriorly is related to the posterior fornix of vagina. So anteriorly you will write anterior fornix of vagina, and posteriorly you will write posterior fornix of vagina. In the post relation, the body of uterus, behind anteriorly we had a uterovesicular pouch between the uterus and the urinary bladder. So behind we will be having a pouch between the uterus and the rectum, which is called as rectouterine pouch, with the coils of small intestine, and the supravaginal part of cervix is also related to the rectouterine pouch. Along with that, it is also related to the posterior fornix of vagina. So this completes the anterior and posterior relations of the uterus. Coming on to the lateral relations. So in the lateral relations, if we speak about the body of uterus, so if this is a body of uterus, laterally it will be related to a broad ligament, which we will discuss further. Along with broad ligament, just on the lateral surface we will be having the uterine artery, which will be giving its arcuate branches. So we will be having uterine artery and vein along with broad ligament, which will be present lateral to the body of uterus. In the supravaginal part of cervix as well, we will be having ureter as well as the uterine artery, which will be related to the supravaginal part of cervix. In the vaginal part of cervix, we obviously have the lateral fornix of vagina. So it's very logical. The vaginal part of cervix will be related to a part of vagina itself, because it is located in the vagina. That vaginal part of cervix will be anteriorly related to the anterior fornix of vagina, posteriorly related to the posterior fornix of vagina, and laterally the vaginal part will be related to the lateral fornix of vagina. So as long as you are speaking about the vaginal part of cervix, this should be related to one of the fornices of vagina itself. So as relations of uterus is completed, next we have to speak about the ligaments of uterus. So we can divide the ligaments of uterus into false ligaments and true ligaments. Now true ligaments are the one which provide the support to the uterus, which means they will keep the uterus in its normal position. They do not allow the uterus to fall down, and this falling down of uterus in medical terms is called as uterine prolapse. So these true ligaments will actually do a function, which means they will prevent the uterine prolapse or the fall of the uterus from its normal position. Whereas false ligaments are mere peritoneal folds. They do not actually provide any significant support, they are just the folds of peritoneum. So therefore these are also called as false ligaments. So we have 4 false ligaments and then 4 true ligaments. So first we will start by understanding the true ligaments. So there are 4 true ligaments. The first one is round ligament. The transverse cervical ligament is also called as cardinal ligament, or also called as the ligament of McEnroe, which will be discussed under the heading of supports of uterus. And then we have a uterosacral ligament and pubocervical ligament. So these are the 4 ligaments of the uterus which are true ligaments, which actually provide the support to uterus. The second one is false ligaments, in which also we have 4 ligaments. The first one is broad ligament. As I already said, the lateral part of the body of the uterus is related to something called as broad ligament. So that is a broad ligament which is present on both of the sides. So therefore it will be paired. So we have a broad ligament, then we have a rectouterine fold located anteriorly. So these will be paired. And then we have uterovesical fold, which is also called as anterior ligament because it is present between the uterus and the urinary bladder. So that is a uterovesicular fold which is present anteriorly. And then rectovaginal fold, which is located between the rectum and the uterus. So this is a rectovaginal fold which is posterior ligament. So anteriorly we have a uterovesical fold and posteriorly we have a rectovaginal fold, and therefore these two are also called as anterior ligaments and posterior ligaments, and they are just single, but these two were paired. And all of the true ligaments are going to be paired itself. So these are the different false ligaments and true ligaments. So 4 true ligaments and 4 false ligaments. First we'll start from false ligaments. As already said, false ligaments are just the peritoneal folds and they do not provide any support to the uterus. But true ligaments are fibromuscular folds, and therefore they are very important supports to the uterus. The first false ligament of the uterus is the broad ligament. This broad ligament is related to the lateral wall of uterus. This extends from the lateral pelvic wall to the lateral wall of uterus. So this joins the uterus to the lateral pelvic wall on each side, and therefore the uterus along with 2 broad ligaments on right and left side. So if this is the uterus and if these are the broad ligaments which join the uterus to the pelvic wall, this broad ligament along with the uterus forms a septum across the pelvic cavity, and this septum, which is formed by the uterus and the broad ligament, divides the pelvic cavity into a smaller anterior part containing the bladder and a larger posterior part containing the rectum and coils of small intestine. There are four different parts of broad ligament. The first part is the mesosalpinx related to the fallopian tube. The second one is the mesometrium related to the body of the uterus. Third one is meso-ovarium, and fourth part of the broad ligament is infundibulopelvic ligament. So if this is the fallopian tube, this is usually a lateral section. So if we take a lateral section and this is the anterior and posterior direction, and if this is the fallopian tube, so the broad ligament hangs in the form of napkin over the fallopian tube. So broad ligament hangs just like a napkin over the fallopian tube, and therefore because it is hanging like a napkin on the fallopian tube, this has a anterior layer as well as a posterior layer. So the one which is extending in front of the fallopian tube will be the anterior layer, and the one which is extending behind the fallopian tube will be the posterior layer, and this will be related laterally to the body of uterus, and this will be related anteriorly and posteriorly to the fallopian tube. First part is mesosalpinx. Mesosalpinx is a part of broad ligament located between the fallopian tube and ligament of ovary. So in between the fallopian tube and ligament of ovary, we have the mesosalpinx. This can be understood with the help of this diagram. So mesosalpinx will be located between the fallopian tube. So if this is a fallopian tube and if this is the ligament of ovary, so in between the ovarian ligament and in between the fallopian tube, whatever part of broad ligament is present, this is called as the mesosalpinx. Between the ovarian ligament as well as between the fallopian tube, this is the mesosalpinx. The second part is mesometrium. Mesometrium is the one which is related to the body of the uterus. This will be extending towards the lateral wall of pelvis as well. And the third part is infundibulopelvic ligament, which will be starting from the infundibulum of the fallopian tube and it will be going towards the lateral pelvic wall, and therefore it is called as infundibulopelvic ligament. The third part is meso-ovarium, which is not seen in this diagram because this is a posterior view of broad ligament, and the meso-ovarium will be going anteriorly. So mesosalpinx is the part of the broad ligament which basically extends. If this is a fallopian tube and if this is a round ligament of ovary, so in between the fallopian tube and the ligament of ovary, the part of broad ligament will be called as mesosalpinx. Mesometrium is part of broad ligament which extends from the pelvic floor to the ovary, and it also attaches to the ovarian ligament and body of uterus. So mesometrium will usually start from the pelvic floor. So if this is a pelvic floor, so starting from the pelvic floor we have the mesometrium. It further extends towards the ovary as well as the ovarian ligament as well as joins to the body of uterus. So this whole part of the broad ligament is called as mesometrium. It starts from the pelvic floor, extends towards the ovary, extends towards the ovarian ligament, and further it joins to the body of uterus. This whole part of the broad ligament is called as the mesometrium. Mesometrium, so therefore it will be related to the body of uterus, because uterus usually has three linings. The first one is the epithelial lining itself, which is called as endometrium, and after that we'll be having a muscular lining that is called as a myometrium, and then we'll be having a serosa. So metrium is a word which is literally used only for uterus. So mesometrium will be the part of broad ligament which will be related to the body of. So ovarium is the third part of the broad ligament. So this is itself the posterior layer of broad ligament. So as I said, if this is considered to be a fallopian tube, the broad ligament hangs just like a napkin. This will have an anterior layer and posterior layer. So the posterior layer itself, which is going to be extending towards the ovary, and it will be attached to the ovary, and the one which lies below the ampulla of the fallopian tube is itself called as meso-ovarium. So the posterior layer of the broad ligament, which starts from below the ampulla of the fallopian tube and extends towards the ovary, is called as the meso-ovarium. There are three parts of fallopian tube: infundibulum, ampulla as well as isthmus. So the part of broad ligament which is posterior layer of broad ligament extending towards the ovary as well as attaching to the ovary is called as the meso-ovarium. The fourth part is infundibulopelvic ligament. So infundibulopelvic. Infundibulo means it will start from the infundibulum of the fallopian tube and then it will extend towards the lateral wall of pelvis, and while its way it also gets attached to the upper pole of the ovary. So this infundibulopelvic ligament is also called a suspensory ligament of ovary. It is a part of broad ligament which starts from the infundibulum of the fallopian tube. So this is the infundibulum of fallopian tube, and if this is a lateral pelvic wall, so it basically attaches the infundibulum of the fallopian tube as well as the upper pole of the ovary to the lateral wall of the pelvis. So this is the infundibulopelvic ligament attached to the infundibulum as well as the upper pole of the ovary. And the importance of infundibulopelvic ligament is that in this infundibulopelvic ligament, which we will be having the ovarian vessels as well as the lymphatics as well as the nerves, whatever are present, they will be actually supplying to the ovary through this infundibulopelvic ligament itself. So the nerves, blood vessels as well as lymphatics of the ovary will enter the ovary through the infundibulopelvic ligament, and therefore this is also called as suspensory ligament of the ovary. So this completes the 4 different parts of the broad ligament. The first one is mesosalpinx, related to the fallopian tube and the round ligament of ovary. Mesometrium, which starts from the pelvic floor, goes towards the ovary, ovarian ligament and the body of uterus, that is the mesometrium. The third part is the meso-ovarium, which is not seen in this diagram because that is a posterior layer of broad ligament going towards the ovary. And the fourth one is infundibulopelvic ligament, starting from the infundibulum and upper pole of the pelvic ligament, starting from the infundibulum and upper pole of the ovary and going towards the lateral wall of the pelvis. Contents of broad ligament. So broad ligament contains one tube, which is the fallopian tube. It has 2 arteries. The first one is uterine artery and second one is the ovarian artery. It also has 2 nerve plexuses. The first one is the uterovaginal plexus and second one is ovarian plexus. It also has 2 ligaments. The first one is the round ligament of uterus, which is not seen in this diagram, but it also has the ovarian ligament. So the one ovarian ligament and one it has is the round ligament of uterus, and it also has 3 embryological remnants. The 3 embryological remnants are epiphoron along with its duct, which is also called as Gartner's duct, vesicular appendicitis and peripheron, and we also have other structures like lymph vessels, lymph nodes as well as fibroolnar tissues. So these are all the contents of the broad ligament. So starting from the first, that is a one tube, and we have to think logically. The tube which is present in the broad ligament, obviously there is just one tube related to the uterus, and that is the fallopian tube. Ligaments, 2 ligaments will be there. One ligament meant for the ovary, which will be obviously the ovarian ligament, and second one is the ligament which is meant for uterus, and that will be obviously the round ligament of uterus. There will be also 2 arteries. The first one is one for the uterus, that is uterine artery, one for ovary, that is the ovarian artery. There are 2 nerve plexuses, one for uterus, which is the uterovaginal plexus, and one for ovary, that is the ovarian plexus, and 3 embryological remnants which we have to remember: epiphoron, peripheron and vesicular appendicitis. Along with the epiphoron, we will be also having its duct, which is also called as Gartner's duct, and apart from these, other structures will be there like lymph vessels and lymph nodes along with some amount of fibroolnar tissue, and this diagram has to be drawn. The next false ligament of the uterus is the uterovesical fold, and because uterovesical fold is present between the front of the uterus and the upper surface of bladder, and it is located anterior to the uterus, it is also called as anterior ligament. So if this is a uterus and anterior to that we have a bladder, so there is a fold of peritoneum which starts front of the uterus and upper surface of bladder, and that part is called as the uterovesical fold, and it's also called as anterior ligament. The peritoneal fold which is present posterior to the vagina, posterior to the posterior fornix of vagina and in front of the rectum, is called as rectovaginal fold. Now rectovaginal fold and rectouterine fold are separate, and these two have to be not confused, because in rectovaginal fold we consider the posterior fornix of vagina and not the uterus and the front of the rectum. So because it is present posteriorly, it is also called as posterior ligament. So if this is a posterior fornix of vagina and if this is the rectum, so in between these two we have a peritoneal fold which is called as a rectovaginal fold, and because it is located posteriorly, it is also called as posterior ligament. The fourth false ligament is the rectouterine fold. Now there is a pair of semilunar peritoneal folds which is located between the rectum as well as the uterus ka one part, that is cervix. So between the rectum and the cervix we have the rectouterine fold. Now these rectouterine fold actually form the lateral walls of the lateral boundaries of the rectouterine pouch of Douglas. As we already studied, if this was the vagina and if this was the rectum, so in between these two we have the peritoneal pouch, and that pouch is the rectouterine pouch of Douglas. So the lateral wall of the rectouterine pouch of Douglas is obviously formed by the rectouterine fold itself. The importance of this rectouterine pouch of Douglas is that this is the most dependent part of the pelvic peritoneal cavity. So inside the pelvis, whatever peritoneal cavity is there, in that the most dependent part is actually the rectouterine pouch of Douglas. That completes the false ligament of uterus. Now we have to study the true ligament. Supports of uterus or the true ligaments of uterus. Now there are certain structures which provide the support to the uterus, and these number of structures prevent the uterus from sagging down or they prevent the uterine prolapse, and these all together help to keep the uterus in its normal position, that is the anteverted and anti-flexed position. These all structures together are called as the supports of uterus, or the true ligaments of uterus is one of the supports of uterus. So supports of uterus can be divided into primary or chief supports, which can be muscular, visceral or the fibromuscular supports. These primary or chief supports are the major factors which keep the uterus in its normal position. But we also have secondary or accessory supports. These secondary or accessory supports are just the peritoneal folds, and this can include the peritoneal ligaments, uterovesical fold, rectovaginal fold, and we also have the rectouterine folds. These all are peritoneal folds and they do not have any major role in providing the support to the uterus. Uterovesical fold, as it is present anteriorly, it's also called as the anterior ligament of uterus, and rectovaginal fold, because it is present posteriorly, it is also called as the posterior fold of uterus. Speaking about the primary or chief support, so there can be certain muscular structures, or there can be viscera, or there can be fibromuscular ligaments. These all act in the form of primary or chief supports of uterus. Muscles, there can be the pelvic diaphragm, urogenital diaphragm, and the perineal body. These three muscular structures will be dealt separately in the pelvis, and these three muscular structures not only provide the support to the uterus, but they also provide a major support to almost all of the organs which are present in the pelvic cavity. Second, we can have the viscera surrounding the uterus. Anterior to the uterus, we have the urinary bladder. Just below the uterus, we have the vagina as well as the uterine axis itself. These three factors will prevent the uterus from sagging down. Urinary bladder, which is present anteriorly, will compress the uterus and it will prevent the uterus from falling downwards, as well as vagina, which is itself present below the uterus, prevents the uterus from falling down. And uterine axis, for example, the uterine axis like axis of anteversion and axis of anteflexion, these two axes keep the uterus bent and therefore they prevent the uterus from sagging downwards. Thirdly, we have the fibromuscular supports. These fibromuscular supports can be of four. The first one is transverse cervical ligament of McEnroe. Second one is pubocervical ligament, uterosacral ligament, and round ligament of uterus. So from understanding the name itself, we can get to know where the different fibromuscular ligaments are located. So this figure explains the fibromuscular supports of uterus when we take a section of pelvic cavity from upwards. So we can see that behind we have the sacrum, in the anterior part we have the pubic bones. These are the pubic symphysis and the pubic bones. So this is the posterior and this is the anterior direction, and we have the three openings. First one is rectum, which is present posteriorly. In between we have the cervix, which also represents the cavity of the uterus, and third we have the bladder, which is present anteriorly. So this goes anterior from posterior. So the first ligament is a transverse cervical ligament. This transverse cervical ligament starts from the lateral wall of the cervix as well as the lateral wall of vagina, and it extends towards the lateral pelvic wall. This ligament is called as transverse cervical ligament. The second ligament is the ligament which extends from the cervix and it goes anteriorly and it gets attached to the posterior part of the pubic bones, and this ligament which is extending from the cervix to the pubic bones is called as pubocervical ligament in case of females. But in males, as there is no cervix and there is a prostate gland, in males the pubocervical ligament corresponds to the puboprostatic ligament in case of males. So the first one was transverse cervical ligament, which is also called as cardinal ligament or ligament of McEnroe, which will be discussed soon. Second one is the pubocervical ligament, which extends from the cervix to the posterior aspect of pubic bone. This is the pubocervical ligament. And third ligament, which goes backwards starting from the uterus to the sacrum, that too at the level of S2 and S3 vertebrae, it will go and get attached, and this ligament extending from the uterus to the sacral vertebra is called as the uterosacral ligament. So uterosacral ligament is present posteriorly. Anteriorly we have the pubocervical ligament, and the one which is going laterally is the transverse cervical ligament. We will discuss about each ligament in detail. The last one was round ligament of uterus, which goes which pulls the uterus forward, and this can be seen in other diagrams. So this diagram, which is in the form of lateral view, when we cut the uterus into two halves in the midline, but when we look at the uterus from the sideways, that is in a lateral view, we will be able to see the round ligament. So this round ligament pulls the uterus forward, and we have the uterosacral ligament which pulls the uterus backwards. It is getting attached to the S1 to S3 vertebra. So the one ligament which pulls the uterus forward is the round ligament of uterus, which further enters the inguinal canal. Then pulling backward, we have the uterosacral ligament. So these two ligaments together help to keep the uterus in its position. So the first ligament we have is a transverse cervical ligament, which is also called as ligament of McEnroe or cardinal ligament. The reason we call it as cardinal ligament is because it is the most important ligament which is required for the support of uterus, which means to prevent the uterine prolapse, this ligament is the most important one, and therefore this ligament is also called as cardinal ligament. What is it composed of? It is mainly formed by the condensation of pelvic fascia which is present around the uterine vessels. So surrounding the whole pelvis we have a pelvic fascia. Pelvic fascia surrounds whole of this pelvic cavity. But what happens is around the cervix itself we will be having the pelvic fascia, and this pelvic fascia which will be present lateral to the cervix will get condensed, and this condensed pelvic fascia around the cervix surrounded by the uterine vessels itself forms the transverse cervical ligament. So it is formed by condensation of pelvic fascia around the uterine vessels which is present lateral to the cervix. If we speak about the location of the transverse cervical ligament, first of all it extends from the lateral aspect of cervix as well as upper vaginal wall, and then it will run towards the lateral pelvic wall. This has been already shown in the diagram. It starts from the lateral wall of the pelvis as well as the lateral wall of the vagina, which is not seen in this, but it starts from the lateral wall of cervix, then it extends laterally and it goes and attached to the lateral pelvic wall, and therefore it is called as transverse cervical ligament. And each of the ligament forms a fan-shaped fibromuscular band. So they are explaining that the shape of the band is fan-shaped fibromuscular band, and they also form a hammock which supports the uterus from downwards, and it prevents the downward displacement of the uterus. So if this is the uterus placed over here, so from the cervix to the lateral wall we will be having the transverse cervical ligament. So this acts in the form of hammock. It basically acts in the form of swing, and it prevents the downward displacement of the uterus. It holds the uterus in its position itself. Clinical correlation, there is a condition called as prolapsed uterus, where the uterus actually goes down as its normal position. It does not stay in the lower pelvic cavity, it descends downwards, and that is called as uterine prolapse. But what we do in case of uterine prolapse is that we actually tighten the McEnroe's ligament. So sometimes it can be because of the loosening of the McEnroe's ligament. So there is a surgical repair of the prolapsed uterus is done mainly by tightening this McEnroe's ligament, and by tightening this we will make sure that the uterus stays in its normal position, and it prevents the downward displacement of uterus from happening. Therefore tightening of the McEnroe's ligament is commonly done in case of surgical repair of prolapsed uterus, so that it does not displace downwards, and this tightened ligament will make sure that it does not displace downward. The second ligament we have is a pubocervical ligament. As already we said that pubocervical ligament goes anteriorly. It is a pair of fibrous bands which extends from the cervix to the posterior aspect of pubic bone. So it starts from the cervix, it will move anteriorly, and it will get attached to the posterior aspect of the pubic bone. So if this is a pubic symphysis, it will get attached to the posterior aspect of the pubic bones, and because it is starting from the cervix and going towards the pubic bone, it is called as a pubocervical ligament. In case of males, it will be called as puboprostatic ligament. Third ligament we have is a uterosacral ligament. It is again a pair of fibrous bands. We have already discussed that all of the true ligaments are paired. And this uterosacral ligament is the pair of fibrous bands which extends from the cervix to the sacrum at the level of S2 and S3 vertebra. It passes on each side of the rectum. So as it is going posteriorly, it will pass on each side of rectum. So we have two uterosacral ligaments. They will begin from the posterior aspect of cervix, and they will move from each side of the rectum, and they will get attached to the sacrum at the level of S2 and S3 vertebra. That is the extent of the uterosacral ligaments. So these lie below the rectouterine folds of peritoneum. So we know that we had a posteriorly going, we had the peritoneal folds, and those peritoneal folds which were going posteriorly were called as the rectouterine folds, which are present between the rectum and uterus. So just below this rectouterine folds we have the uterosacral ligament, because both of these are present posteriorly. And what are the rectouterine folds of peritoneum? These rectouterine folds of peritoneum form the boundaries of rectouterine pouch of Douglas. This has been already discussed in the false ligament, because rectouterine fold was a type of false ligament itself. What is the importance of uterosacral ligament? Importance of uterosacral ligament is that this ligament will pull the uterus backwards. So it pulls the uterus and cervix backwards against the force which has been caused because of round ligament. Round ligament pulls the uterus forwards, but against that force we will be having uterosacral ligament which pulls the uterus backwards. So these two ligaments together will balance the uterus, and they will keep it in its normal position, and they maintain its normal axis of anteversion and anteflexion. So importance of uterosacral ligament is that it pulls the cervix backward against the forward force caused because of round ligament, and it helps to maintain the normal anteverted and anteflex position of the uterus. So this diagram again gives gives a lateral view of the ligaments of the uterus. The first one is round ligament, which goes anteriorly and enters the inguinal canal, which will be discussed next. And second one is the uterosacral ligament, which pulls the uterus backwards and prevents the forward pull of the round ligament. So the fourth and last true ligament of the uterus is the round ligament of uterus, which is also called as ligament teres uteri. So this is a pair of long ligaments. It is of 10 to 12 centimeters. It is a fibromuscular band and it is long, approximately 10 to 12 centimeters. It lies between the two layers of broad ligament. So we have already discussed the broad ligament has two layers. If we assume that this is a fallopian tube, the broad ligament lies in the form of napkin, and therefore it has an anterior layer and a posterior layer. So in between these two layers, we will be seeing the round ligament of uterus will be running in between these two layers of the broad ligament, that is anterior and posterior layer of broad ligament. In between these two, we will be having the round ligament of uterus, which will be running. If we speak about course, so it starts from the lateral angle of uterus. So we have the angle of the uterus, and this lateral angle of uterus, if we assume that this is the lateral angle of uterus, so from the lateral angle of uterus, the round ligament of uterus begins from the lateral angle of uterus, and then it passes forward as well as laterally. So as it starts, it not only passes laterally, it also comes forward. So once it comes forward, it will run between the two layers of broad ligament, that is anterior and posterior layers. Later on, it will wind around the lateral side of inferior epigastric artery. So it moves forward, then it winds around the lateral side of the inferior epigastric artery, then it enters a deep inguinal ring. After entering, so usually the inguinal canal has two openings. So if we assume that this is an inguinal canal, the one which is located deeply will be the deep inguinal ring and superficial inguinal ring. So it enters on the lateral side of the inferior epigastric arteries, it enters the deep inguinal ring, and then it transverses through the inguinal canal, and then it will emerge out of the superficial inguinal ring. So as it emerges out of the superficial inguinal ring, it will actually come out in the form of thread-like fibrous structures, and these thread-like fibrous structures will further go and they will merge with the fibroareolar tissue of the labium majus, which is a part of external genitalia. So they will go and merge with the fibroareolar tissue which is present in the labium majus. These ligaments pull the fundus forward and they maintain the axis of uterus, that is anteversion anteflexion axis of uterus will be also maintained by the forward pull of the round ligaments, apart from the uterosacral ligaments which pull it backwards. Uterus is pulled back through the uterosacral ligament, as we have already discussed. So that was the course of round ligament. It begins from the lateral angle of the uterus. As it begins from lateral angle of uterus, it will move forward as well as laterally. It will move forward and laterally, then it will wind around the inferior epigastric arteries, and then it will enter the deep inguinal ring. It will transverse through the inguinal canal, and then it will come out of the superficial inguinal ring in the form of thread-like fibrous structures. These thread-like fibrous structures will go and they will merge with the fibroareolar tissue of the labium majus, which is a part of external genitalia, and that is how round ligament will pull the uterus forward against the backward pull of the uterosacral ligament, and they will help you to keep the uterus in the anteflexed and anteverted position. Next point of discussion is blood supply of uterus. Starting with the arterial supply, there are two arteries which supply. One pair of uterine artery, which is the major blood supply, but we also have one pair of ovarian arteries which supply the uterus only partly. So mainly it is supplied by uterine artery, partly it is also supplied by a pair of ovarian arteries. Uterine artery is a branch of anterior division of internal iliac artery. If this is the abdominal aorta, it divides into two common iliac arteries. Common iliac arteries divide into the internal iliac artery and the external iliac artery. Internal iliac artery further divides into anterior division and posterior division. Anterior division of internal iliac artery gives the uterine artery. It is a branch of anterior division of internal iliac artery. The course of uterine artery, first the uterine artery starts from the pelvic floor in the base of the broad ligament. So if this is a broad ligament, it starts from the base of the broad ligament. It runs medially towards the cervix. It runs medially towards the cervix, and as it goes towards the cervix, it crosses the ureter, and because ureter carries the water, basically the urine, and because this is going to cross the water in the form of a bridge, so therefore this correlation between the uterine artery and ureter, this is also called as water under the bridge. Water under the bridge, because the uterine artery acts in the form of a bridge of the water which is present inside the ureter. So it crosses above the ureter, and therefore it is called as a water under the bridge, and then it goes to the lateral, it goes laterally towards the cervix as well as lateral to the lateral fornix of vagina. Then as it extends further lateral to the body of the uterus, then at the superolateral angle of the uterus, it reaches till the superior lateral angle of the uterus, and from the superolateral angle of the uterus, it takes a lateral turn, and in the lateral turn, it will run along the fallopian tube. it will run along the fallopian tube, supplying the medial 2/3 of fallopian tube, and then it will give a ovarian branch of the uterine artery, and by giving the ovarian branch of the uterine artery, it terminates by anastomizing with the ovarian artery. So as it forms anastomosis with the ovarian artery, this is how there will be a termination of the uterine artery. Next is branches and distribution of the uterine artery. First, near the cervix. Near the cervix, it can give the cervical branches, ureteric branches, vaginal branches. Now these cervical branches form a circular anastomosis around the isthmus. So as it runs medially starting from the pelvic floor, it will go towards the cervix. Near the cervix, it will give certain vaginal branches, cervical branches, as well as the ureteric branches. It also supplies the ureter. It also supplies the cervix, and the cervical branches usually form the anastomosis, and these anastomosis will be seen surrounding the isthmus. So these are the branches of the uterine artery which are seen near the cervix. In the side of the body of the uterus, it gives this arcuate branches. So at the side of the body of uterus, these branches which will be coming towards the side of the body of uterus are called as arcuate arteries, and these arcuate arteries give the branches both anteriorly as well as posteriorly, and these will come from both of the sides, and therefore they will be forming an anastomosis in the midline of the uterus. So at the side of the body of uterus, it gives certain arcuate branches. These arcuate branches supply both anterior as well as posterior surfaces of the body of uterus, and these arcuate branches anastomose with their counterpart, which means anterior branch will anastomose with the anterior branch coming from the right side and the left side. So there will be anastomosis of their counterpart coming from the other side, and this anastomosis will take place in the midline. So the anterior branch coming from right side will anastomose with the anterior branch coming from posterior side, from the left side. Similarly, the anterior branch which is coming from the right side will anastomose with anterior branch which is coming from left side. Similarly, we'll also have posterior branches of the arcuate arteries. These posterior branches which will be coming from right side will anastomose with its left counterpart coming from the opposite side, and this anastomosis occurs in the midline of the uterus. Along the fallopian tube, we also have tubular branches, and these tubular branches supply the medial 2/3 of fallopian tube, and the lateral 1/3 of fallopian tube will be supplied by the branches coming from the ovarian artery. Therefore, we can conclude that uterine artery not only supplies the uterus, but as it gives the vaginal branches, cervical branches, ureteric branches, it also supplies the vagina, it also supplies the cervix, it also supplies ureter because it also gives a ureteric branch. It also supplies some of the structures which will be coming in broad ligament, and most importantly, the tubular branches also supply the medial 2/3 of the fallopian tube. The venous drainage corresponds to the arteries itself. So there are venous plexuses which are seen along the lateral border of uterus. So in the lateral border of uterus, we have certain venous plexuses. These venous plexuses will drain into the uterine and vaginal veins, which will further drain into the internal iliac veins. Lymphatic drainage of the uterus. So lymphatic drainage of uterus is clinically very important because whatever uterine cancer is there, it mainly spreads to the lymphatics itself. So understanding the lymphatic drainage is very important because the metastasis of the uterine cancer, metastasis is basically spread of the cancer from one organ to the distant organ. So the organ from where the cancer has originated, from there where it spreads to other organ, that is called as metastasis. So for the metastasis of the uterine cancer, the lymphatics are the main source. These lymphatics take the cancer from the uterus to the other organs. There are three parts we have to understand of the uterus, and these three parts will have three different lymphatic drainage. The first part extends from the fundus to the lower part of the body of the uterus. So this part, that is the fundus of the uterus along with the upper part of the body of the uterus, is the first part. Second part is the lower part of the body of uterus, and third part is the cervix. So the first part, that is the fundus as well as upper part of body of uterus, will drain into the pre and para-aortic lymph nodes, as well as the junction between the fundus and the fallopian tube. So this junction drains into the superficial inguinal lymph nodes. And the second part, which is the lower body of uterus, drains directly into the external iliac lymph nodes. And the third part, which is the cervix, drains into three different lymph nodes. So laterally it will drain into the external iliac lymph nodes, the obturator lymph nodes. Posterolaterally it will drain into internal iliac lymph nodes, and posteriorly it will drain into the sacral lymph nodes. So understanding it diagrammatically will simplify everything. The first part is between the fundus as well as the upper part of the body of uterus. So this part drains into the pre and para-aortic lymph nodes. So this completes this part. Now there is one part which is present between the junction of the fundus and fallopian tube. Now this junction of the fallopian tube and the fundus, this part of the uterus drains into the superficial inguinal lymph nodes. So this completes the first part, that is fundus and the upper part of body of uterus, which drains into the pre and para-aortic lymph nodes. The second part is the lower part of the body of uterus. Now this drains into the external iliac lymph nodes. This part is going to drain into the external iliac lymph nodes. The third part, which is the cervix, drains into all lymph nodes. It drains into the internal iliac lymph nodes, external iliac lymph nodes, obturator lymph nodes, as well as the sacral lymph nodes. But understanding it more simplified, first of all, laterally it will drain into the external iliac lymph nodes and obturator lymph nodes. Posterolaterally it will drain into the internal iliac lymph nodes, and when we go posteriorly it will drain into the sacral lymph nodes, because sacral lymph nodes will be located posteriorly. So posteriorly it will drain into the sacral lymph nodes, posterolaterally into the internal iliac lymph nodes, and laterally it will drain into the obturator lymph nodes and external iliac lymph nodes. So this is a lymphatic drainage of uterus, which is very important because this is a site or path through which the metastasis of the uterine cancer will take place from the uterus to the other organs of the body. So we have to understand it by dividing the uterus into three different parts. The first part is fundus and upper part of the body of uterus, which drains into the pre and para-aortic lymph nodes. The second part is the lower part of the body of uterus, which drains into the external iliac lymph nodes. And third part is cervix, which drains laterally into obturator lymph nodes and the external iliac lymph nodes, posterolaterally into the internal iliac lymph nodes, and posteriorly into the sacral lymph nodes. Lastly, coming on to the applied anatomy of the uterus. First of all, cervical carcinoma, because cervix is a part of the uterus itself. Cervical carcinoma is one of the most common cancers in the females, and the second most common cancer in the females is the breast cancers. Now, cervical carcinoma is important because this cervical carcinoma can metastasize. As we already said, metastasis is a process through which the cancer spreads from its original organ to some other organ. So it can spread directly to the adjacent structure through the metastasis. It enters the pelvic lymph node, then it can go to the pre and para-aortic lymph nodes, and therefore it can enter the other major abdominal organs as well. Fibroids are so understanding about fibroids are the benign tumors which arise from the myometrial cells. These myometrial cells are the muscular cells which are present inside the Fibroids are benign tumors which arise from myometrial cells. So if this is a uterus has three layers. The first one is the epithelial layer, which is the endometrium, and then we have the myometrium, which is the muscular layer, and then we have the serosa. So myometrium, which is the muscular layer, contains the myometrial cells, and the benign tumor coming from this muscular layer is called as the fibroids. These fibroids are usually multiple and they can undergo certain degenerative changes. Clinical features, mainly the woman will have the abnormal uterine bleeding, which is also called as hypermenorrhea. So she has excessive amount of bleeding, and there will be irregular counter of uterus on doing a bimanual examination. So on the bimanual examination of the abdomen, there will be irregular counter of uterus along with excessive bleeding. But if the fibroid is small, it will be usually asymptomatic and it requires no treatment. But if the fibroid is very large, then the main treatment of the fibroid is to do a hysterectomy, which is removal of uterus, and that is a treatment of choice in case of large fibroid. What is a cesarean section? Cesarean section is a surgical procedure for delivering the baby by cutting open the abdomen and the uterus if normal vaginal delivery is not possible. Usually the delivery of the baby is done through the vagina, but in certain complications or in certain high risk pregnancies, the normal vaginal delivery is not possible. So in that case, we have to actually give a small incision on the abdomen as well as on the uterus, and that incision is mainly given in the lower segment of the uterus, and therefore this type of cesarean section is also called as lower segment cesarean section. And this lower segment cesarean section is done only when the normal vaginal delivery is not possible, and the delivery of baby is done by cutting open the abdomen and uterus if the vaginal delivery is not possible. So this completes the whole topic of uterus. Thank you one and all, and this is an important 10 marker.